Hi, I'm Dr. Peter Edelstein. I'm Chief Medical Officer at Elsevier Clinical Solutions. We're here at the HIMSS Asia Pacific 2015 meeting, and we have an award winner for the Elsevier HIMSS Outstanding ROI Achievement Award. Tell us a bit about what you were trying to solve and how you did it with this award-winning project.
So it was a joint initiative basically between two hospitals as well as the outpatient pharmacy group, which deals in a polyclinic setting. So it was three different institutions coming together, with IHiS doing the solutioning and project management, and then doing the business development with the different providers of pharmacy automation and software to try and put together a combined solution to meet everybody's slightly different needs and requirements. What we saw was that in the outpatient pharmacies in Singapore, they're quite unique in that patients come to the actual polyclinics as well as the specialist outpatient pharmacists to collect their medications. And what we saw is that there is a constant crunch of resource and demand at the pharmacies to collect their medications. It's quite unique in Singapore that people collect the medication actually at the acute setting as well as in the polyclinic. And it was reaching a tipping point where the patient expectation in terms of how long they're prepared to wait for medications was being exceeded by the demand, just the number of patients, the number of medications that were being prescribed and dispensed. So the only way forward that would be sustainable would be to look to see how we can automate the solution, such that the pharmacists can create capacity to be able to serve more patients while achieving patient safety, but also still meeting the high expectation of the patients in terms of waiting times. Yeah.
So tell us about how you brought in technology to help you address those problems.
When it comes to pharmacy medication supply, especially in the outpatient setting, there are actually quite a number of mature technologies. I think previously, in previous years, some institutions in Singapore had tried to implement certain types of outpatient dispensing technology and automation, but with very limited success.
Right.
Those robots and automation in the recent years have become quite mature. The challenge in Singapore is that they have a very wide formulary, many different types of dispensing forms. We have boxes, we have blisters, we have syrups, we have loose medications, we also have bulky items. So to achieve a high level of automation, we actually needed to employ at least 3 types of automation.
Wow.
And then combine them together with a workflow software that can help to prioritize the patient demand and the line items that need to be dispensed. So it was quite a complicated project in terms of managing the different types of automation and getting them all to work together with a central coordinating software.
And what time frame did you do this?
Actually, work first started, I think, as far back as 2009. They spent more than 2 years visiting other hospitals, looking at the types of automation that could potentially meet the needs. In terms of actual procurement implementation, it's probably been about 3 years from calling the tender to actually having a solution that was up and running at some of the institutions.
And tell us about your outcomes, and tell us, if you would, about the ROI you believe you're delivering.
The ROI that we have is basically, I think, in 4 main areas. 2 of them tangible, 2 of them probably intangible to a certain extent. The first one is in terms of manpower savings. So obviously through the widespread use of automation, I think up to 80% of the line items are automated.
Wow.
And that's not by formulary, but that's by actual volume. So that was able to create a lot of savings in terms of manpower.
Absolutely.
But those manpower are not thrown away, they're actually being redeployed. So they're redeployed especially to focus a lot more on providing direct patient care, improving the patient compliance, spending more face time with the patient, rather than pharmacists spending time essentially doing a warehousing or supply chain type job.
So improves patient satisfaction. And then what about the initial goal of reducing those wait times during the crunch hours? How's that been affected?
So it's been a gradual process. In fact, when we first automated, what happened was the waiting times actually got worse.
Does that scare you for a minute?
Yeah. But now we see that it's improving almost month on month. One of the major institutions, National University Hospital, is able to achieve 15-minute waiting time for the patient at the 95th percentile.
And what was it prior to automation?
I think the average waiting time, I think, was more than 20 minutes.
Okay, so it is significant for
Yeah.
them. That's terrific. So you're already seeing ROI, both tangible and intangible. And then the last question is, having gone through this, what were one or two of the major challenges in retrospect, the real bumps in the road? Because these are big projects.
I think the biggest bump we had was that we did a very traditional kind of IT requirements-based project. We sat down with the users and the vendors. We went through a waterfall approach to gather their requirements and then do a design and then do an implementation. When we first saw the system, when we came to testing, actually it was a shock. And the system was pretty unworkable because it was something very, very new to everybody.
Right.
And in fact, what we had to do was we basically had to wipe out and start again. And
wow.
The way that we did that was we also changed from that traditional kind of waterfall approach, and we actually did a more agile approach, where we actually formed basically a product team with the users, and the users actually drove the development and the product features in a series of sprints. And in fact, the developers actually reported to the user in terms of the deliverables that they were doing. So it was a
very different approach to the
completely
project.
different, but in the end, the users really got what they wanted.
Great. Well, congratulations again to the winner of our ICT ROI Achievement Award. We look forward to presenting you all with the award tonight. All our best, and thanks for participating.